At ATP, we're a full-service wellness centre.
We have a very high success rate here.
The highest standard of patient care.
Physical therapists at ATP are wonderful.
We have a lot of return clients.
It makes me feel great.
The equipment at ATP is state-of-the-art.
The best quality of fitness and medical rehabilitation.
So we really cater to all walks of life.
I had no idea how much more strength I would have.
I'm stronger than I've ever been. Overall fitness, I'm a different body and a different mind.
We developed ATP with a mind-body approach, treating the body as a whole, not just the injured body part.
Our aim is to get people back to be able to perform their activities of daily living, pain-free, and to the best of their abilities. What we do at ATP is physical therapy, fitness in Pilates.
We have a great gym, we have cardio equipment, we have free weights.
We also have a nutritionist that works with us.
We have 5 private treatment rooms, which is very important, especially when we're dealing with, obviously, the women's health issues.
50% of women by age 55 and 3/4 of women by age 75 will have some problems related to pelvic floor relaxation. Well, why is physical therapy so important? Because 60 to 80% of women who have these problems will not need surgery initially. But if we can intervene earlier, the woman might have improvements in symptoms and defer surgery until a much later age. I've been sending patients to ATP for many reasons. They have personalized care that involves looking at specific symptoms and tailoring a program to a woman's individual needs. I also send patients to ATP because there's a terrific line of communication between our surgeons and the therapists at ATP.
I came to ATP about 6 months ago, a year after having had back surgery. And after having tried physical therapy at a couple of other places that really just didn't suit me. When I came to ATP, my objective was to manage back pain. I did 3 months of physical therapy and have since now graduated to Pilates. I can say that I have been pain-free the last 2 months, which just to me is just almost a miracle.
I have battled rheumatoid arthritis for 25 years, and I've had 3 total knee replacements. I found that the hands-on physical therapy and the Pilates was just awesome. I'm stronger than I've ever been. I have more joint flexibility and mobility in general.
You see a swing. If I can look at a golf swing, I can determine whether their injury is caused by their golf swing and how we can rectify that. And then if it is not a golf-related injury, how they can modify their swing to stop aggravating an injury they've already got. We also do aquatic therapy. Aquatic physical therapy is good for many things, especially people that are unable to tolerate land-based therapy. If you've got a total hip replacement, a total knee replacement, the buoyancy aspect of water is going to be most beneficial for you. Aquatic therapy can be good for not just joint replacements, but it can be any orthopedic condition you can think of, and neurological conditions, MS, arthritis, etc. So many people benefit from aquatic therapy.
The physical therapists at ATP are wonderful with aquatherapy. I never would have recovered anywhere near as fast as I have, and lost weight as well. I had expected to get to where I could move, but I had no idea how much more strength I would have, how much flexibility I would get, how much faster I would recover. My surgeon was astonished because in a short 6 weeks, I was walking far past his expectations.
Many times we see the client again in our fitness. They come in and they continue with their exercise program, either in Pilates, or if they prefer weight training, they can also do that too.
The results we see here every day make it so worthwhile having this great facility.
In summary, the relationship between our pelvic floor center and ATP works so well because we share the same philosophy.
It doesn't stop there. We're always going to be continuing to look for new ways of making people feel better and function better.